diabetes. November is National Diabetes Month in the United States, and we here in Tennessee have a pretty big problem with this disease. It's very prevalent. Rachel Fox is a nurse practitioner at St. Thomas. Welcome to the program.
Thank you for having me.
And so you see a lot of patients struggling with diabetes in your practice or at St. Thomas. Talk to us about how preventable diabetes is.
You know, diabetes, type 2 diabetes in particular, pre-diabetes is the time to capture diabetes and prevent the onset of type 2 diabetes. And there's several interventions that we can intervene with lifestyle modifications, dietary modifications, and there are studies that suggest initiating medication therapy with metformin is very effective in delaying the onset of type 2 diabetes particularly. So,
describe, educate us more, if you will, on the difference between type 1 and type 2.
Well, type 1 diabetes is an autoimmune disorder, and what that means is the body's immune system essentially attacks itself. Its own, it's supposed to defend the body, but it turns on itself and kills the cells inside the pancreas. And for that reason, insulin is only treatment for type 1 diabetes. Type 1 diabetes tends to affect, it can affect children and adults, but primarily starts in children. And type 2 diabetes is by far the more common. It affects 90% of the people affected with diabetes. So when you hear the term diabetes thrown out, typically that's what they're referring to is type 2. And it's just a metabolic disorder where the pancreas that produces the hormone insulin is not producing enough adequate supply, and the insulin that is being produced is not functioning properly in the body, which leads to high blood sugars.
And that leads to, in turn, other health problems for patients, such as?
Well, think with me for a minute, because blood goes everywhere. And when you imagine everywhere that the blood flows in the body, you can get a picture of what all it affects. And glucose is a very sharp and jagged molecule on a molecular level. So when you put lots of concentration of glucose into the bloodstream, and there's high concentrations of that flowing throughout, it can cause lots of damage throughout the body. So what that turns into with the eyes, blindness, retinopathy, with the heart disease, heart attack, stroke, with the kidneys, paralysis, and the nervous system, nerve damage, where you can lose sensation over your body with feeling, and peripheral circulatory disorders that eventually can lead to limb loss and amputation. Devastating
losses, devastating
Absolutely.
Side effects from diabetes. You painted a very clear picture through your description just now of the jagged molecule. I've never heard anybody describe that, so that really brings it home. So talk about pre-diabetes, and what is that, and how can we stop it in its tracks? You mentioned through lifestyle modifications.
Well, pre-diabetes is the precursor for type 2 diabetes, and so the blood sugar is elevated, but not enough to receive the diagnosis of type 2 diabetes. And so that is a great time to implement some interventions, like I had mentioned, lifestyle modifications, weight loss, increased activity, increased exercise, and healthy dietary choices are all very, very powerful in not only preventing the onset of type 2 diabetes and delaying that onset, but even people with type 2 diabetes and slowing the progression of the disease.
What are some of the symptoms? How would you know that you are getting into dangerous territory?
Well, the three classic symptoms are polyuria, polyphagia, and polydipsia, which just mean that there's excessive thirst, excessive hunger, and excessive urination. And those three are often combined with an unintentional weight loss because of the degree of dehydration that's going on in the body.
Okay, you said increased hunger and fatigue. What about, do you have, you see blurred vision, obviously, that's that comes along
blurred
with
vision, recurrent infections, weight loss, like I mentioned.
It says here numbness or tingling in the feet or hands, sores that don't heal. Now that's, at that point, you're pretty far down the pike with it, right? Some of these things, I mean.
Sometimes it can go undiagnosed for years, and so some of those symptoms are actually symptoms of the complications of untreated diabetes.
Do you see that often?
Very often.
How do you reach people? I mean, obviously this kind of program, but what else is being done in the healthcare field to reach more people who are unaware and, you know, are not educated on taking good care of themselves?
Well, I work in the hospital with St. Thomas, an inpatient, and we do a lot of screenings on patients that are having surgeries or just in the hospital, and we identify that there's some hyperglycemia and high blood sugar going on, and we do screenings to expedite that diagnosis, and especially even capture people in that pre-diabetes state, and from there give them referrals over to the St. Thomas Diabetes Outpatient Clinic, where they can get not just education, further education, but also the treatment and interventions, meeting with a dietitian and making those, helping implement some of those dietary and lifestyle modifications.
Does it tend to run in families?
There is a very strong family component to it, so that does increase the risk when it runs in the family.
How can you best manage diabetes? You know, once you have it, how do you really maintain a healthy lifestyle?
Well, in addition to the lifestyle modifications and the dietary healthy choices, I would add to that testing blood sugar, being very aware of your personal trends, and with glucose monitoring, following up with your healthcare team, communication, and being very consistent in taking your medication as prescribed, support groups, staying connected with the community, staying connected with family and friends. And one that's not often talked about is just maintaining a healthy mental state and mental health, so that internal motivation is there, because diabetes can be a very challenging disease to manage for healthcare professionals and people with the disorder alike. So.
That's a critical component. I'm so glad you added that. Thank you so much for your insights and educating us more about diabetes. Thank you, Rachel. Thanks for coming in. And we'll be back with more of the program right after this.